Tracy McNally lives in constant pain. Her cervical cancer became incurable after it spread to her liver and her lungs. She watched her parents suffer long and drawn-out deaths and is determined to end her life on her own terms.
The only option for me when I feel the time is right is to do it myself, you know. It's not something that you want to do, but I don't want my family, going through what my mum and dad went through. I don't see the point of being here knowing that you're maybe going to die in 1 or 2 months and you're lying in bed, you can't get out, you can't, you're relying on people, stuff like that, and you end up with no dignity.
In Scotland, assisting someone's death isn't a specific criminal offence, but if anyone helped Tracy end her life, they could risk being prosecuted for murder or culpable homicide. She believes a change in the law is long overdue. The Scottish Parliament is being asked to consider if assisted dying should be legalised. This is the 3rd time a bill has been brought forward here. The MSP pushing for the change is confident the mood of the country has shifted and Scotland could become the first UK nation to do this.
The public support for a change in the law has been overwhelming for some time now. It's confirmed by polling released today that showed 2/3 of support across Scotland and support in every part of the country. The political mood's taken a bit of time to catch up, but I think that is now happening.
Under these proposals, 2 doctors need to rule that a patient in an advanced stage of a terminal illness is mentally fit enough to make the decision to end their own life. The person would need to be over 16 and they would need to have lived in Scotland for at least 12 months. So there won't be the option here for someone to visit Scotland the way someone from the UK may visit the Dignitas clinic in Switzerland at the moment. The medics would also have to determine that no coercion had been involved in the process. It's expected that MSPs will get their first vote on this bill in the autumn. For some, the safeguards being talked about simply aren't enough.
Coercion can be very specific and it can also be quite broad, and if we look at the narrative around disabled people as either benefit cheats or scroungers, people that are taking from the state if they need social care, and people that have got things they shouldn't have, that narrative itself can feed into that coercion. So we know the conversations that disabled people have about how much of a burden they feel on their family, their friends and on the state in some cases. It's utterly tragic, and against that backdrop this is very dangerous.
There are already moves to change the law on assisted dying on the Isle of Man and Jersey. Rishi Sunak and Keir Starmer have both pledged to allow a debate on the issue at Westminster after the next general election. Dame Esther Ranson, who is considering travelling to Switzerland to end her life, has congratulated the Scottish Parliament for prioritising this debate. But there are no guarantees that MSPs who won't be told how to vote by their parties will actually pass it. What if this doesn't work, this attempt to change it?
I think we'll just keep trying. Why give up? Came this far and it just keep going.
Whatever happens, the conversation around assisted dying continues to grow louder.
Catherine Sampson reporting there. Well, joining me to discuss this sensitive issue is Ali Thompson, who's Director for Scotland of the campaign group Dignity in Dying, and Dr Gordon MacDonald, who's the CEO of Care Not Killing. Thanks to both of you for joining us. Dr MacDonald, first of all, it's hard, isn't it, to hear someone like Tracy McNally. She is in constant pain. She knows she's dying and she knows she would like some control over her death, and this bill could give her that. What is wrong with that?
I mean, these stories are tragic and heart-wrenching, but we've also got to listen to the voices of people like Pam Duncan-Glancy, who have experienced discrimination every day of their lives, probably, and systems that aren't sympathetic. Many people had do not attempt cardiopulmonary resuscitation orders placed on them during the pandemic without their knowledge in hospitals. And, you know, medics probably thought they were doing the right thing, but, you know, we've got to consider those who are marginalised, those who are vulnerable as well. You know, and Liam MacArthur's bill is much broader than he said it's going to be. It includes euthanasia as well as assisted suicide, and many disabled people will qualify because he's redefined terminal illness. So, you know, there's a lot of ambiguity about what's being proposed.
Ali Thompson, the issue is and has always been that of safeguards to protect the people that Dr. MacDonald is talking about, people being drawn into assisting dying when they don't want to die. How can you convince people that the safeguards are exactly that, true safeguards?
Well, I think the first thing to say is that there's nothing safe about the current law, the blanket ban on assisted dying. It forces people like Tracy to consider taking matters into their own hands. That's obviously not an ideal situation at all. It can lead to very violent, very lonely deaths. We know that many people across the country, the actual suicide rate for the terminally ill population is more than double that of the general population. That's not acceptable at all. We've also seen people like Esther Ranson considering Switzerland. There's no monitoring or oversight of people going to Switzerland. What Liam MacArthur's bill does is put compassion at its heart, but safety at its core. It puts those vital safeguards in where none currently exist. And anybody worried about protecting vulnerable people would see that this is the bill that will do just that.
I mean, Gordon MacDonald, this argument has been raging for years and years, and it is a very binary one often. But Liam MacArthur, the MSP who is behind this bill, is convinced that this time it will get through, that the tide of public opinion has changed, that 2/3 of people being polled are now in favour. Are you finally losing the argument here?
Well, the opinion polls haven't shifted in the last 10 years, quite frankly. And, you know, what has happened is every time parliaments have looked at this issue, the politicians have decided it's just not safe. And they're concerned about people who are vulnerable. And all these same assurances have been given in the past. Margot MacDonald, the late Margot MacDonald, said the same things as Liam MacArthur's now saying. Dignity in Dying said the same things. You know, the other groups said the same things. But when the Parliament looked at these bills, they decided that they were wanting. And, you know, this bill is also wanting because it's actually impossible to draft a safe bill. And when you look at what's happening in Canada, and this bill is very similar to the Canadian legislation as it was originally introduced, we see that people are having assisted deaths or euthanasia deaths because they're lonely or because they are not getting access to the care services they need. They may qualify in some of the criteria, but their real motivations for seeking it are existential factors which should be addressed in other ways.
Ali Thompson, on exactly that point, you know, Care Not Killing have argued that any rise in support is partly because of a fear that the NHS is in crisis, that the hospice movement is not properly funded, and therefore that there won't be good enough palliative care for people. That would be worrying if that was the case, wouldn't it?
Well, we've just had a report back from the Westminster Health Select Committee, which has shown that there's no detriment to palliative care at all in the jurisdictions which have legalised assisted dying. In fact, if anything, it improves. We know from speaking to doctors in those countries where assisted dying is legal, that actually for dying people, and can we just be really clear here that Liam MacArthur's bill, it says it in the title, assisted dying for terminally ill adults, is for people who have an advanced terminal illness. The choice is not between living and dying. That choice has been taken away. It's between a painful, prolonged death or when somebody gets to choose the limits of their own suffering and die in their own terms. But the actual
Thompson,
sorry
to interrupt you, just sorry to cut across you there, Ali Thompson, just very, very briefly. Dr. MacDonald doesn't seem convinced that this bill will get through this time. Are you?
Yes, I am. I think our MSPs see the terms of this bill, a very measured proposal, compassion and safety at its heart, and they can see that really doing nothing is the worst and the least safe thing to do here.
Ali Thompson, Gordon MacDonald, have to leave it there, but thank you both for talking to us this evening. Thank you.